Good day, I am Dr.K Gireesh, physician, neurophysician and neurosurgeon. This is the RNA series number 66. RNA is nothing but random questions in neurology and neurosurgery with answers by Dr. K Gireesh. This is to benefit the practitioners of neuroscience and the medical field for a lifelong learning and also for public awareness. In this series, the question that I am addressing is, what is the anatomy, the function and the clinical significance of Papez circuit? Now, James Wenzel Papez, he proposed the Papez circuit in 1957. He proposed the mechanism of emotion. That was a paper by him. He suggested a neural circuit linking emotion with cortical processing and later integrated into the broader concept of limbic system, which was expanded by Paul MacLean. The James Papez is an American neuroanatomist and a neurologist, the best known for proposing the Papez circuit. He worked at the Cornell University and Ohio State University. James Papez laid the foundation for neuroscience of emotion and greatly influenced the later researchers such as Paul MacLean, who popularized the term limbic system. Papez believed the circuit. He generalized the emotional experience is connected emotion with the body experience, integrating it memory and emotional expression. Now let's see the components of this Papez circuit stepwise. Hippocampus is the origin, especially the subiculum of the hippocampus. The role is memory encoding and emotional contact via the fornix, and the fornix is the major efferent pathway of the hippocampus, and it comes down to the mammillary bodies, which is a part of the hypothalamus, an important relay for the memory processing. So that is the mammallo, and via the mammillothalamic tract it goes to the anterior nucleus of thalamus, integrates memory and emotion signals. From the anterior nucleus of thalamus it goes to the cingulate gyrus. Conscious emotional experience occurs and the behavioral response to emotion, and via the cingulum it comes down to the parahippocampal gyrus or the entorhinal cortex and returns to hippocampus. It's very important, see. So from the hippocampus via the fornix to the mammillary bodies, and from the mammillary bodies to the antenucleus of thalamus, cingulate gyrus, the parahippocampal gyrus, and back to the hippocampus. So that forms the Papez circuit. So the hippocampus, the fornix, mammillary bodies, from there to the antenucleus of thalamus, and from there to the cingulate gyrus, back to parahippocampal gyrus and the hippocampus. So that forms the Papez circuit. It is originally proposed. Now what is the functional significance of this Papez circuit? Originally proposed for emotion, now understood to be crucial for memory, especially episodic memory. Hippocampus, thalamus and the cingulate group, integration of experience with emotion. The second one is emotion processing, links the visceral, hypothalamic and the cortical cingulate responses. The third is the behavioral integration, emotional stimuli with cognitive interpretation and behavioral output. So therefore, you have the functional significance as part of memory, especially the episodic memory, emotion processing and behavioral integration. The clinical significance of it: 1. In Korsakoff syndrome, due to thiamine deficiency as a result of alcoholism, the lesion is in the mammillary bodies plus thalamus. Features: you get the anterograde amnesia, confabulation. So that is a classic Papez circuit disruption. Alzheimer's disease, the early involvement of hippocampus, entorhinal cortex, and leads to progressive memory loss. Anterior thalamic lesions causes amnesia, disorientation, seen in stroke or tumors. Temporal lobe epilepsy involves the hippocampal circuitry associated with emotional aura and the memory disturbance. Cingulate gyrus lesions affects apathy, emotional blunting, and impaired attention, psychiatric disorders, dysfunction linked to depression, anxiety, and PTSD, post-traumatic stress disorders. So these are all the abnormal emotion processing circuits occur. So the core circuit is the hippocampus, the fornix, the mammillary bodies, anterior nucleus of hypothalamus and cingulate gyrus back to parahippocampal gyrus and hippocampus. Function is memory plus emotional integration, and the mammillary body lesion can lead to Korsakoff syndrome, and hippocampus can lead to early Alzheimer's involvement. The most important references, the evidence-based presentation, Papez J.W. in 1937, a proposed mechanism of emotion published in the Archives of Neurology and Psychiatry. MacLean P.D. 1949-1952, psychosomatic disease and the visceral brain in a psychosomatic medicine has been published. Eggleton and Brown et al., the episodic memory, amnesia and the hippocampal anterior thalamic axis in the behavioral brain sciences. The human brain, an introduction to its functional anatomy by Bloomfield in the neuroanatomy through clinical cases, brings about what happens when the Papez circuit gets involved. So, just a one-line summary if you want to say about a Papez circuit. The Papez circuit is a limbic loop connecting hippocampus, the mammillary bodies, thalamus, cingulate cortex, critical for integrating memory and emotion, with the lesions causing characteristic amnestic syndromes. Thank you very much.